The Honest Psychiatrist. Episode 3.
I'd like to tell you something before you ask me.
Sure, go on.
I am a psychiatrist, but also a bit of a philosopher. My secret to deciding which SSRI or SNRI antidepressant to prescribe? Well, when a patient comes into my office, I just look into their eyes, and I get the inspiration I need. Or probably, it's just influenced by the advertising notebook under my nose. By the way, some of my most boring patients have told me that they find the promotional pads with the names of psychotropic drugs distasteful. But I love those little gadgets. They give my office that personal touch, and every time I tear one of those pads off, I remember that I really am a graduate.
Are there also aspects of your working day that you find less satisfying?
When they come to me claiming the damage of psychotropic drugs just because I'm a psychiatrist, I don't want to plug my brain in. I prefer to keep a smile on my pretty face.
Don't patients have to report adverse events?
I can't stand conceited patients who report the side effects of psychotropic drugs. I like to tell them that it is their own mental problems and that it is better to increase the doses.
What do you mean by conceited patients?
Call me a dickhead, but I am the doctor, and I will not allow a psychiatric patient to instruct me on things I don't know about the effects of my prescriptions. Besides, they insist on being right. When I get patients ruined by my prescriptions, I don't feel guilty at all, and when they become aggressive and threaten to report me, I calm down thinking that it was all in label. But I admit, I can't stand people who raise their voices.
Can psychotropic drugs really ruin people?
I worked my ass off to get a degree in psychiatry. Toxic or not, it's not my problem. I comfortably follow the chart with symptoms, diagnosis and prescriptions. I loved Battleship as a child. Besides, I have a face like an ass, and even when it is clear to everyone that simple serotonergic drugs can ruin people's lives, I will still say that these are urban legends.
Aren't psychotropic drugs supposed to be good for patients?
Well, yes. There are indeed patients who consider antidepressants to be their lifesavers. Now they promote these drugs with their friends, defending them from attacks, and saying that the danger reported by other people doesn't really exist, that it's all made-up stories to scare people, and that you have to rely on psychiatrists for treatment. Lovely.
Do you despise patients who have complications?
Oh yes, I think patients who are pissed off about their supposed post-SSRI sexual dysfunction should be sedated with more psychiatric drugs as soon as possible. Personally, I consider sex sleazy. I have never loved it. And when patients are angry about the sexual side effects of SSRIs, I get a certain satisfaction and tell them that it is not so important for their mental health.
Do you think that in order to become a psychiatrist it would be appropriate to pass an admission test, including a psychological framework?
A psychological framework? That's a mischievous question, isn't it? I pretend not to recognize the perversity and villainy in me, but I love it. Today, a young patient for whom I prescribed Lexapro told me that if he got sexual dysfunction as a side effect, he wouldn't be any happier. Well, I told him this. Preemptive fear about the possibility of a side effect is to be considered a symptom of illness, in an attempt to control the drug therapy, because after all the desire would be not to take it. Isn't that brilliant?